is on. All right, good morning, everyone. I'm very sorry I'm late. I actually went to the Heart Foundation building, and then I was told it was here, but I'm very sorry. I'm very crazy about punctuality. My name is Luciano. As Holly was saying, I work at the Sex Institute. I don't know if you guys heard about the Sex Institute, but we do a lot of work with policymakers and decision makers. And I work at the Research Asset Division, which is part of the 45 and up, is one of our research assets. Just for a bit of context, the 45 and up study is a study of people that are 45 and over, as the name says. It looks at healthy aging, only New South Wales residents. We have about 265,000 people in the study, and we follow them. So we started, the first collection was in 2008. So now it's about 10 years since the first collection of data for the study. We do have a lot of research projects. Most of them are in the field of epidemiology and public health. We have all types of qualitative, quantitative research, different types of research. Mostly, again, looking at healthy aging. So that's what I do. So my job with the 45 and up study is to facilitate the impact of the study. And I do that by developing knowledge translation resources, developing networks with different stakeholders. And at the moment, we've changed a bit our application process to look a bit like what you guys have to do for your grant. So we are very interested in learning about how the researchers will plan for impact and how the type of processes and pathways that they will use to get there. And we also introduced a new thing. So when they send us their expression of interest and application for the study, they have a little impact, NELA translation impact box that they need to fill out. So then I can give them a call if they want to, and we can talk about impact and things like that. So I think the talk today is very similar to what we do as well for the Sex Institute. So hopefully this will be quite interesting. You might notice that I talk a bit funny. So if you can place my accent, like my very broad Aussie accent, is from a part of Australia called Brazil. So that's where I'm from. So if you can understand what I say, or if I say a word funny, for instance, the 45 and up study, I cannot ever say that word, is a longitudinal study. I hate that word. I also curse a bit, so I'm sorry if you guys get offended by cursing. So I'm part Italian as well, so that's what happens. Okay, so I think today for this hour, it's a long hour, and we're going to talk about certain things that you might use for your knowledge translation planning. So we're just going to do a very quick introduction of what knowledge translation, I call it KT because it's easier, what KT is, what impact is, and then we're going to see how we can use KT as a pathway to get your impact. And then we're going to look at some of the lessons from other grant bodies. So the REF in the UK, do you guys know, have you heard about the REF, REF? So the REF is what we call Research Excellence Framework. It was used in the United Kingdom to, you don't want to say it was used to kind of allocate funding, but that's what they do. So they looked at educational institutions, and they wanted to measure the impact that they've produced through their research. And some of the funding was kind of connected to that. So if they scored well, they kind of got a bit more money. So they looked at engagement, impact, and another thing that I forgot, but impact was one of the things they looked at. We're also going to look at some of NHMRC lessons and some lessons from Canada. So my KT training was done in Canada, so that's why I use knowledge translation and not knowledge mobilization or exchange or whatever you guys use in Australia. So we're going to talk about that as well. So speaking about that, you will know knowledge translation by different names. I think has everyone here not heard about knowledge translation? It is okay if you put your hand up. Good. Has anyone here used any of these words to mean the thing that they want to achieve from their research? What's the word that you mostly are familiar with? Just say one word. Anyone? Reserve, yeah, that's a good one. I didn't understand, but yep. So I wonder if it's up there. So this is, so in Canada, we use knowledge translation as kind of a broad term that encompasses all of the process from developing, thinking about what you're doing, all the way to delivering that evidence, okay? So knowledge translation is a very broad kind of word in Canada. And another thing that you need to remember is that knowledge translation is not the same thing as implementation, okay? So knowledge translation is the strategies that you use for your evidence to reach the person you want to reach. Implementation is one of the strategies that you use. It's how you plan to get those strategies done, okay? So they are similar, but they are different. And knowledge translation is one part of the, the implementation is one part of the KT umbrella, all right? So when I talk about KT, I want you guys to understand that I'm using like the broad term of knowledge translation, okay? Right, so I'm not gonna be one of those guys that are gonna tell you to do 20 different activities because I don't like that when people are presenting. I'm a bit shy, and I don't like to talk to people much, which is weird for a knowledge translation person. But what I want you to do is I'm gonna give you a very classic knowledge translation exercise, okay, that we do in Canada quite a lot, because I want you to think what knowledge translation means. So, you're in a strange city, and I will provide you with an evidence-based document to help you get home. All right? And I want you to think, how the hell are you going to get home with this document, this evidence-based? It's an evidence-based document. It's real data. I want you to use that to make an informed decision about how you're going to get home. Can anyone do that? No, because you know what it is. Who does not know what it is? Oh, it's the Tokyo subway map, exactly. So what's the point here? The point here is that sometimes you create this, you do your amazing research, you get this awesome evidence, you've done like, you know, your data analysis and all that stuff that you do, and then you develop a resource. It's beautiful, shining, completely evidence-based. It's being proved by 20 different people, and then you get your knowledge user to use that. Does that even matter if you use something like that? If you don't know what it means? So if your audience doesn't know what it means, if your knowledge user doesn't know what it means, what is the point of developing something like that? Okay, so that's a little bit of, that's an example of knowledge translation is. Knowledge translation is not magic. It just kind of helps you get there and think about the resources that you produce to your different audiences. Another thing that's very common when you talk about knowledge translation, you have to mention the gap. Everyone, the gap. Everyone talks about the gap. And the gap is that issue that there's a very big disconnect between researchers and patients who need to use the evidence they have developed, okay? So as a classic, not a classic, as an example for you, I don't know if you can read that. I'm sorry if it's too small when you print out as well. I am a physio by background, so I've been a physio for about 20 years, and I was also a clinical researcher for the last 10 years. And most of my research comes from the field of osteoarthritis, so prevention and management of osteoarthritis. So that's an example of a gap, right? So for instance, we know that this has already been, okay, so you can't see my pointer. Can you? Oh yeah, there you go. So this has already been studied ad nauseum. There is enough evidence right now out there that the first thing you do for a person with osteoarthritis is you do this first. You do what we call a stepped care approach. So you have a first line of treatment, and more often than not, it's going to follow this pathway, right? So first thing you do is you get them to exercise, you get them to have a healthy lifestyle, you get them to lose weight, blah, 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 blah. You get them drugs or not, and if everything else fails and the person's quality of life is quite affected and they can't go on, you get them to have surgery and have a joint replacement, okay? But that's like the logical kind of framework that you use for that kind of stuff. So the gap here is that us, as researchers, we are kind of developing this evidence, and we've been doing this for about, sorry, I mean crap. Sorry, that wasn't intentional. We've been doing this for quite a while, so we've generated all this amazing evidence, and then what we usually do is, okay, I've done this, and now I'm sure if I publish it or go to a conference or whatever, everyone's going to use my evidence, okay? But what we do know, also, subconsciously, is that not actually true, right? So if you look at the health indicators, healthcare quality indicators, you looked at osteoarthritis in Australia, people with osteoarthritis will receive about 43% of what we call inadequate treatment, which follows this pathway here, okay? 43%, that's a lot of people that are not receiving the right type of treatment, all right? That's what we call the knowledge translation gap is, I have this, and I'm trying to change this, benefit people from my treatment, but that's actually not happening in real life, right? And the reason for it might be that your evidence that you're trying to implement is actually not reaching the people that need to use that evidence. And there are some reasons why that happens. Mostly two reasons. So one of the reasons is what we call a knowledge production problem and a knowledge translation problem, okay? So a knowledge production problem means I am doing research that's actually not relevant. Because as a researcher, I have looked at an issue in the literature and I think we should study that. And therefore I'm going to do this study and I'm going to implement those findings. But then you talk to the people that actually need that and they say, I don't care, that's weird, I don't know what you did that study. And it doesn't help me at all. So that creates a lot of waste in research. Professor Glasgow is a professor from Bond University. He's done a lot of studies on research wastage, and I would advise you to, if you're interested in that, and how to prioritize research, is to actually go read his research. He's extremely good and he's very didactic. Is that a right word? Didactic, yeah. With his research as well, so he explains things quite well. And this is a little diagram of where the research gets lost. So not only you have questions that are irrelevant to people, but you also have a whole issue with the methodology and the translation of your research, okay? So from developing a protocol to actually doing the protocol, there's a big difference that researchers go through. They don't usually implement the right protocol, right? So something happens. So there's a whole lot of stuff on that side of research wastage that could happen to avoid you from getting your preferred implementation outcome. So that's a knowledge production problem. And then on top of that, you actually have a knowledge translation problem as well, right? An example in Australia is the diabetes research. So you've heard about the pipeline of research, right? So you start with all this information, and then for information to get from here to there, it has to travel a lot of steps and go through a lot of people and go through a lot of different types of research and things like that. And all of that needs money. You need funding, you need more people to help you, you need a bigger team and things like that. So by the time your research plan gets implemented, you've gone through a really big pathway, jumped through hoops, and then issues might have happened, okay? So if you look at research, diabetes research institutes in Australia, 84% of them do both basic and clinical studies. Half of them have a clear process to connect both of those groups within the same institute, but only 16% of them actually make that connection between the two different groups, okay? So that's just an example of a chronic disease issue in Australia and how there might be a problem with knowledge translation. So then if you think about, so my research evidence is not moving, it's not doing what I want it to do, so what's the big deal with that? So there's a whole lot of, again, information about it that you can search and look for. And you can see the main issues are, your research will take longer to be implemented, obviously. As we looked for the case of osteoarthritis, people do not receive the right care, or, even worse, they might receive care that is actually harmful to them, and they don't need to be exposed to that. And you also have that issue, again, of the research wastage, okay? And that also creates a couple of problems. So the knowledge production and knowledge translation gap is actually a problem because researchers, and I include myself in that as well, we treat healthcare problems as linear, very simple type of problems. So we have this we have this mind that we go, okay, so I have this problem, I need to solve this, and these are the actual steps I need to take. So we kind of think of this linearity with research when you actually know that it's not like that, okay? So health problems are quite complex and complicated because you have to consider all the context around it, where your research evidence is going to make a difference, who's going to use it, who's interacting with it, and all that kind of stuff. And complex problems cannot, well, they can, but it's very hard for them to be solved by just one person looking at one little thing if they're not considering the whole context in which their evidence inhabits. And there's also, on top of that, you have this, it's called the two communities view. So you have this disconnect between policymakers and researchers, right? So on one side, you have your researchers saying, policymakers don't care about my research. And then you have the researchers going, or the other way around. Researchers, yeah. So the policymakers, it's very hard to, we think that policymakers don't want to engage with us, but it's not true. It's quite hard to engage with them because you don't know how to. So most of the researchers in Australia, about 40, I can't even remember the name now, but about 43% of them want to connect with policymakers, but they don't know how to do it. So that's a very big problem. And another reason why that evidence is not reaching people that need it is if you think about the traditional knowledge production process, right? So for instance, if you're a researcher and you say, okay, this is a problem that I need to solve, I will write my proposal as you guys are doing now, I will get some funding, and then I'll run my project, and then at the end of my project, I'm going to find out that I need more research. And then I'm going to go again, and I'm going to do another proposal, another funding, another research project. And usually that will lead to a publication, right? So we go back to that issue that if I just develop an evidence, somehow people will interact with it, and an impact or a change or a benefit will come out of it, right? But we know that's not really true. There's two ways that, if you think of a traditional knowledge exchange or knowledge transfer pathway, there are usually two ways that researchers and policymakers do it, what we call a one-way pathway. So either you have a push or a pull. So a push is a researcher has done a research, and at the end, so he didn't consult his knowledge users, he didn't consult any policymakers or the stakeholders. And they said, this is what I want to do, this is what I found out. And now they have to show that to a policymaker or a decision maker that might be interested in using that. Okay? So just at the end of the project, of my research project, I now developed a little, whatever dissemination resource I have, and I'm going to show it to people that they need that. That's obviously a problem, right? On the other hand, you also have policymakers or decision makers that are pulling evidence that's already out there. So they really want to answer to a problem that they have, but they don't know how. So they just go around searching for whatever type of evidence anywhere to try and solve the problem instead of actually working in collaboration with the researcher to try and answer that, right? So that's what we call the traditional knowledge transfer pathway, like the one pathway to research, either from the researcher to the policymaker or the other way around. So how can KT help with that process? How can we make it a more integrated approach to knowledge translation? So let's say you have your you've identified a gap in the literature or from a previous research project, and you now develop this shining new evidence-based knowledge. And according to our traditional knowledge transfer pathway is, I've done it, therefore people are just going to use it and everyone will be happy and we're going to solve all the problems. But we know that's not true. We know that your research evidence actually leaves Greenhalgh says that research meanders, so it's never a one-way kind of linearity type of issue. Your research has to go through a whole different pathway to get to your knowledge users, right? So not only you have your evidence that you've just developed, your evidence lives around all these other issues here, right? So you need to think about what are the people going to think about it? How are they going to interact with it? Do they really want this or not? How much money I need? Any legal or economical issues or things like that. So what knowledge translation does, it just tries to create a little pathway for you to get from your evidence through all this bullshit to get you the impact, okay? That's it. Like knowledge translation is not magic. It's just a way to help you think about things that you might not be considering. I know you're all very smart, obviously, but sometimes it's hard to think about everything, right? Especially if you've mostly been just doing research for your whole life, okay? So that's what knowledge translation does. It just gives you a little framework to kind of help you do that. And that's how you do it, right? So if you remember, we talked about the push and the pull. And we usually call that an end of grant knowledge translation process, so end of grant knowledge translation problem. When we actually are more interested in what we call an integrated knowledge translation approach, okay? Which means that the researchers and the knowledge users will interact, and you can use a knowledge translation framework to do that if you want. They will interact to make sure that the evidence we are developing in a collaboration will actually be used by people, okay? So that's what KT does. It provides you that active, and so pay attention to that word as well, active. This is quite important when you're talking about knowledge translation. Knowledge translation is not a passive transfer of knowledge. It's an active, you have to do stuff to get it out there, okay? And your knowledge translation frameworks allow you to plan for things and allow you to think about collaborations that might help you. And those collaborations will be quite important for you when you're trying to answer those research questions and how you're going to implement, and that word is important as well, usable findings, okay? Relevant, usable findings. And the KT framework, hopefully, knock on wood, will help you deal with the KP gap, so the knowledge production gap, and the KT gap. So we'll help you create relevant research, and will help you consider how to collaborate in order to implement that relevant research. All right? And an integrated knowledge translation process is nothing new. It has been around for a while. Well, that's not true. So knowledge translation hasn't been around very long, especially in Australia, but we're doing better than the Americans, yes, so that's good, but doing worse than the Canadians, okay? So It hasn't been around for a very long time, but best evidence practice has been around for a while, and it's a similar kind of idea, right? So I need everyone with all their experience to tell me what would be the best practice to do something, okay? I can't just have one person making a decision for everyone else, especially if they're not part of the group that's affected by it, all right? So that's what it is. And if you really want your research to be used in a meaningful way, those are the things you need to consider. You cannot have a knowledge production problem, so it needs to be relevant. This is quite important, be locally contextual, so be aware of knowledge translation research that's been done in America. I'm picking on the Americans. Make sure that, whatever, Brazil, for instance, research that works there might not work here because you have a different audience, right? Research into Aboriginal health would be different from non-Aboriginal health, especially on the way that you disseminate your findings and you interact with people. So that's extremely important. Your knowledge translation framework needs to be contextual. It needs to consider where you are to do that, all right? It's not a one-size-fits-all approach to everything. And the last bit, it needs to be integrated, right? You need to have people that will help you figure out if that's actually a problem or not, and how we're going to implement that solution. So if you remember our traditional knowledge production process that we looked at a little while ago, you remember that the researcher will come here and say, this is the problem I found. I'm going to do a little proposal, get some funding, and do a little research, and hopefully I'll get a publication. And then everyone will read my paper, because it's amazing, and they will use it, all right? Not true. If you think more now, if you put your knowledge translation cap on, you will see that things will change a bit when you're thinking about producing that knowledge and implementing, disseminating your knowledge, okay? So now we have a priority setting here that actually involve different people. So it's not one person going, oh, look at this finding from my previous research, we need to look at this. But also, I'm asking other people that live with that problem, that deal with that problem, that are in the front line dealing with things like that, to help me set a priority, okay? And after that, you have a whole different process that will lead to, hopefully, some change, okay? Or impact. Like that's the fancy name for change, is impact these days. But you can use whatever word you want, change, effect, whatever you want to do. That's what you're trying to do, all right? So you can see how it looks different now. Now I have a much more collaborative process, okay? I look for funding in different places. I have a multidisciplinary, that's another word that's hard for me, kind of team. You have easily accessible data. You develop different resources to synthesize your findings that are targeted towards your audience and your local context, okay? And with that change, your priority might change as well. So now smoking was a problem 30 years ago. It's still a problem, but much better now, much more manageable. So now we need to maybe target something else related to smoking, okay? All right. This is a little break here, and like I said, I don't like funtivities. I don't do funtivities with people. But I want you to think about a couple of things, and this will start helping you considering how you're going to write your research proposal. I'm feeling like I'm talking really loud for some reason. Question one, and you don't need to talk to anyone. I just want you to write down on your piece of paper, if you have one, who do you think will benefit from your research? And the second thing, once that's figured out, I want you to tell me, or yourself on your piece of paper, how would you explain to them why would they benefit from it? So that's a very tricky question we ask researchers. We're doing a really big qualitative message they have for their knowledge users. If you have 3 different groups, I would like you to write down 3 different messages you have for your groups. For instance, we're doing a study with dementia. We're trying to figure out the modifiable risk factors of dementia at the moment. So we're building this steering committee, and we have policymakers, we have clinical practitioners. Okay. So moving on, keep that, what you've written, for your next sessions or when you're thinking about your research plan, because that's the sketch or the outline of your plan. You're starting to build it in your head and in your piece of paper, all right? So we've talked about knowledge translation, and we've talked about how knowledge translation is the process of achieving impact or change, okay? Have you guys heard the word impact before for research? Yes? It's very in vogue at the moment, isn't it? Everyone is talking about impact, and some people don't like the word impact. They think it's quite violent, right? So I guess millennials get upset, so don't. When we talk about I can say that because my daughter is a millennial and she's annoying as fuck sometimes. Can't say anything. Like, I'm a very liberal person, but I have to be very careful when I talk about things. Okay, back to the presentation. So when I say impact, if you don't like the word impact or you want to make it easier, think about change, okay? Think about benefit. That's what impact for research means. And those are just, I threw some definitions for impact up there for you, and you have this on your notes as well. You have a definition from the NHMRC. You have a definition from the Australian Research Council that have also... did you guys read the engagement and impact report from the Australian Research Council? Did you know that Australia was also doing something similar to the Research Excellence Framework, which is they assessed the production of research, the impact of research in Australia for universities in Australia. So they looked at they did a big study asking for impact case studies, asking for the partners of the research, asking for how they've engaged with people and things like that. And in 2018, they have delivered a report that you can look online, and I don't think I have it on your notes, but if you just Google engagement and impact report, you should be directed to the ARC website, so the Australian Research Council, and you can actually read, you can actually look at the applications, and you can actually look at the impact case studies, which might be interesting for you when you're writing your things, to see how people describe their pathway and how they describe the impact that they've had, okay? So that's interesting. So that's an Australian Research Council definition. Then you have the REF there that we talked about. So we talked about the UK REF. That's another definition. And then there's a much easier definition that I think, which is from Julie Bailey and David Phipps in Canada. So, you know, it's the provable real-world benefits derived from academic research and research expertise more generally. And this is important, provable real-world benefits, okay? So you can just say, I have cured HIV. No, come on, dude. Like, we need to know how you've done it, all right? And you need to provide support for that, okay? And an even easier way is impact is the good that researchers can do in the world, all right? That's what it is, a change, effect. Oh, okay, so actually, that's weird as well. So there is this professor from, I can remember, somewhere in the UK. His name is Mark Reed. He does a lot of research with impact. And he actually asks people to consider, because when you think about impact, you think about positive change. he actually asked people to consider about your negative effect of your research, because you've learned quite a lot from that as well, okay? It's the same when you're doing an evaluation of a program, so if you implemented a program, you want to evaluate it, you look at how it worked, but you also look at why it might not have worked, and that gives you a whole heap of good information that you can learn from, all right? So when you're talking about impact, and you're talking about change, or whatever you want to call it, I don't care, call whatever you want, you need to actually understand what's involved with impact, okay? So again, Bailey and Phipps have a really good term that they've coined. It's called the impact literacy. So the argument is that people might know what impact is, but they are not literate on how to achieve the impact that they want, okay? And the reasons why they might not know, it's because they don't consider the whole process involved with impact, all right? So when you think about impact, the first thing you think is, what impact do I want to have? What do I want to change? What is the thing, what's the effect I want to cause with my research? Then once you found that out, you go, okay, how am I going to do that? So I know what I want to do it. How am I supposed to freaking do that? And you also think, all right, so if I want to do it this way, I figured out how I want to do it, who is going to help me do that? Right? So what are the skills? What's the group of people that I'm going to talk to help me achieve that impact? So these two researchers say that most impact, most people, I don't want to use the word fail, but most people do not achieve the impact they want, or they might have to compromise with the impact, because either they just consider how and who will help them to do it. So they're a bit you know, I want you, what do you want to change? You know, I don't know. I want people to, whatever, just be healthy, you know? So that's a bit weird, right? Because there's lots of things that you can achieve with that. So if you don't really sit down and think about your impact, you obviously do not understand what type of impact is. And most importantly, you don't know how to measure it because you haven't thought about the impact, right? So how are you going to measure something that you don't know what you're measuring? So if I want a specific, I want people to, and I'll show you an example that we've done. I want people to maintain their body weight. So then I can go and I can investigate a group of people throughout a period of time to see if they actually maintain their body weight, okay? So you need to be specific. Another issue that's quite common is that researchers, or whoever is involved in research, will say, I know exactly what I want to do, what my impact is, and I also know who is going to help me to do that. But I have no fucking clue of how I'm going to do that. I have no experience. I never talked to a policymaker before. I don't know who to contact. I don't know how to get through to them. So that's another very common issue with research that doesn't get implemented as it was planned, okay? And the last one, it's obviously, I know exactly what I want to do. I have my whole plan of what I'm going to do with people, what are the resources I'm going to produce, which steps I'm going to take, but I have no clue who is better suited to help me. So which group am I targeting? I don't know. I haven't planned for that. So if you don't have this understanding of impact, that it has different things that you need to consider. So you need to know how to create impact, or what impact you want to have, and who's going to help you do that, okay? So it's very important that you understand all those three steps, because then, according to these guys, you're considered as a literate person in relation to impact. Does anyone know types of impact? Obviously you have it on your notes, but have you thought about an impact that your research might have? So from the little piece of paper that you wrote down, Can anyone tell me a type of impact? And I want an impact outside of academia, okay? I don't want you to say, I'm publishing paper. I want you to say an impact that a big group of people can use. Does anyone have an example of an impact? No? What was that? Yes? Yeah? So a health-related impact? A better health outcome? Yeah? Any other type of impact? Yeah? Yeah? A financial type of impact? Yeah, for sure. So those are good examples of impact outside of academia, okay? So this is that guy I was talking to, Mark Reed. He has a really good website that's devoted to impact and knowledge translation. I'm sorry if it's too small in your notes, but it's fasttrackimpact.com, okay? One word. And you find a whole lot of information there. It's really good and really easy to understand and things like that. And he actually, these are the impacts that he thinks that he's been exposed to with all the research, the work he's done with researchers, that would be useful for you to consider when you're developing your project, okay? So, like we saw before, if you don't know what you're changing, first, like it's irrelevant what you're developing. Second, you won't be able to assess or evaluate your research. You don't know if it's just successful or not, because you don't know the impact that you're trying to achieve, okay? There's more impact there. You can read that on your notes, and you can go online. And for each one of these impacts, it has a whole paragraph explaining how you do it, and I'm not going to waste your time doing this here. You also have types of impact from NHMRC, which is, again, like we said, the economic impact, the health impact, social impact. So there's different types of impact. And this little graph on the side here was done by Trish Greenhalgh, and she looked at the 170 or so applications, impact case studies for public health only, for the REF. So there's different areas of expertise, and there's a slide out later that you can see which areas were there. And she looked at the type of impact that the researchers describe that they've had on their papers, okay? So again, it's very similar, right? So inform new revised guideline, change in policy, change clinical practice, economic benefit, reduce mortality. So again, it's a recurring theme there, right? Now a little thing that I would do here is, there's a bit of discussion on the literature about it's a very hard to measure direct impact, right? Extremely hard. So most of the measurement is done through the process of achieving impact, not actually impact, okay? For instance, informed, new, or revised guideline, that's a change of a process, not a change of outcome, okay? A change of outcome is reduced mortality, which is much harder to prove, linked to your study, okay? So it's easier to demonstrate a change of process, right? Informed new service model, it's easier to prove that than it is to prove that improve morbidity because of my study. And as you know, take it with a grain of salt, as the smart researchers that you are, no change comes from one project, right? It's like a big change. That's never gonna happen, okay? So keep that in mind when you're talking about impact as well. So this is a practical example. So if you remember one of the first slides that we had there about the issue with managing and preventing and managing osteoarthritis in Australia, we actually did something about it. So it's called the National Osteoarthritis Strategy. So we looked at all the issues related to osteoarthritis, and you can see that on your thing. And we also saw that as people get older, obviously, the issue of osteoarthritis will just get worse. So then we got together a whole bunch of people, and we've decided to have an osteoarthritis summit at the University of Sydney. And we've invited everyone, private health, insurers, doctors, people with OA, advocacy groups, policymakers, you name it. And we wanted to know from them, what do they think are the main things that we need to do to change or to improve the management and prevention of osteoarthritis in Australia. So that process alone took about 3 months. We did a 1,000 mind thing where you choose the things that you think are important. And then we've developed a national osteoarthritis strategy that had a very clear goal, right? To reduce the impact of osteoarthritis and also to be an implementation plan for those changes that we wanted to do. We developed a whole plan on how to do it. So we had a leadership group, we had a work group. So each group, sorry, yes? How much did it cost? The OA Summit was, the only thing we paid for was the OA Summit, to bring international researchers in and to provide assistance for people that had to fly into Sydney. I don't really remember. But we had funding to do that. So yeah. Yes. So we organized it, so we did everything. So our group organized the whole thing at the University of Sydney. It was free, the venue, so that was awesome. So we put together the whole thing, and the only thing we spent money with was flying people in, and that was pretty much it. But I can't really remember, but I can find it out. Yeah. So all these meetings we didn't pay for anyone to go to the meetings. Each group had a working group, so a prevention group, treatment a group, and an end of stage group. They're looking at surgery and things like that. And we met frequently. We met online. We met in person. We did a lot of papers together and all that kind of stuff. And then we came up with a framework to help us implement the changes that we want to implement, okay? This is my working group. This is the Prevention of Osteoarthritis working group. And those are the strategies that we chose to achieve an impact, okay? And if you have a look around it, we will see that all this evidence and all these interventions, they live within a context, all right? And you have to consider the whole context. You have to consider how are the interventions, how well are they perceived, what's the evidence behind them, what's the policies around it, the legislation around the areas, can you do that or not? Do you have the available resources, money, all that kind of stuff to do all that stuff? This is quite important. Your knowledge users, do they actually care about what you're doing? Do they agree with you that you should do this? Or do they think that's bullshit, I don't need to do that? Okay? So that's important when you're building a framework, all right? So that's how KT helps as a pathway to a change, all right? So if you ask a researcher, they will tell you that the overall goal is that my research will help people. That's what I want you to do as a researcher, okay? And we call that the impact or the change. Again, there's a little definition there for you. And if you think as KT as a pathway to impact, the KT is the process that you're going to use to connect the outputs, your resources or your findings, to generate a change beyond academia. All right? And this is how some people also describe impact and how it's achieved. And I've highlighted some words there for you because don't these words sound very knowledge translation-y kind of words, you know? So knowledge creation, dissemination, uptake, research evidence to inform something, to improve the lives of people, targeting, tailoring activities to reach, engage, co-produce, and involve researchers. So These are all kind of knowledge translation-y, kind of vernaculum kind of stuff that we use. So you can see how they're both linked, all right? It's very hard to have one without the other, so remember, okay? So this is what knowledge translation kind of does. It connects this to this, all right? And the way that you do that, you can use frameworks if you want. You've been given a logic model to use for your application. And if you swing a stick outside, you will hit a knowledge translation framework. There's about, I think the last paper I read, there's about 63 different knowledge translation frameworks. And that's also a problem because people get very confused. They don't know which one to use it, okay? So KT frameworks are very useful. They will help you plan for a lot of stuff. They'll give you a strategy. They'll help you figure out who users are, how you're going to collaborate with them. They help you with a lot of stuff. But here's what's important about it as well, and at the risk of sounding a bit rebellious because you've just been given a logic model to use, consider that there are downsides to using a framework, okay? Most of all is that research from creation to utilization is not really a logical flow. It's not a linear flow. It's very hard to get something very complex and put it in a linear thing. So if I do this, this will happen, and then that will happen, and then at the end, I will have an impact, okay? That's usually not how research works, right? So be very aware of it. Use a knowledge translation framework and a logic model, not as something that you need to tick, and I've done this, this, and this, but use it as the other concept, as something that helps you plan and consider things that you need to consider. All right? Are you guys having a break or something, or what's the deal? Yeah? Oh, okay, right. So I'll just, I'll speed it up here so you don't get caught. Okay, so here's what we plan for KT. Obviously, if you don't plan it, it might not happen. You want to reach a broader group of knowledge users, so if your main goal is to publish a paper, that's totally fine. If that's your impact that you want to have, okay? But if you want to reach a broader audience, you might need to consider different things, okay? So those are some reasons why you would have a knowledge translation framework. And how you do it, again, it's simple to say it, but this is just so you organize your ideas, all right? So those are the things you need to consider. What are your goals, your partners, your audiences, and all that kind of stuff. All right? And you have those notes on your handouts. So when you talk about goals, you might have different goals. They don't have to be these goals. These are more like traditional knowledge translation goals. But they can be whatever goal you have, you just stick it in there and that's your goal, okay? But what I need you to consider is when you're thinking about your goals, so all the other parts now, the partners, the everything else, it's all related to your goals, okay? That's why it's important to have a goal. Remember the what of the impact literacy? It's important to have a goal for your research, because if you don't have a goal, it will be very hard for you to identify the other things on your plan. All right? So your partners can be your stakeholders, can be your project partners. You want to know who they are, what are they going to do, when you're going to involve them, blah, 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 blah. And then you have your knowledge users, who might also be your partners. As you can see, I stuck that back in there again, but they're actually the same, right? So this is I'll share that with you later. That's the KT planning template from Canada that we use, okay? So be specific when you're doing things. How are you going to do that? So there are a gazillion different strategies for you to use. I've just put them under their little thingies there. So you can use a role-based KT, you can use organizational KT. There's a whole heap of them. But please be mindful that all your strategies, holy shit, need to be goal-oriented. They need to be contextual, where you are, and they need to be feasible, obviously. The same, so there you go. Those are just the strategies described in a different way at the template. Okay, so this is interesting, right? So out of all of this and that, how do you know which one to choose? So there's a bit of a discussion. So KT, as anything else in research, there's no real 100% agreement on it. We're still kind of figuring out if KT actually helps or not. It seems to help more than it doesn't help, which is good. But what we figured out is there are certain things that seem to be more effective than other things, okay? So actions that involve what we call knowledge brokering. Have you guys heard about knowledge broker? Do you know what a knowledge broker is? Knowledge broker is someone that's designated as a person that will act as the bridge between the research and the implementation. So that's the person that's there at the place you want to create your change. This person will be there constantly going, do you guys okay? Everyone okay? Do you need help? Or like, have you done this? Have you done that? The annoying person, obviously, the knowledge broker. They need to prioritize so this is quite important, right? So interpretation of research is one of the main barriers why decision makers will not use research. They don't know how to, so that's a big issue. So they want to, but they don't know how to use it or where to look for, okay? So anything that helps with that, as the other one, the facilitate the access, to build their skills, to actually look at it and understand it, and then to have mechanisms that just kind of generate this iterative, that's another word, iterative, what the fucking thing that goes around like this. If you have a process to help with that, that's good, okay? So you have something to help you with that. And then on the other side, you have the things that are not very useful. I just wanted to show you this example here. This is a study that we've done with 45 and up researchers, and we looked at their research applications at the top here. They told us which impact they wanted to have, and they told us how they would achieve that impact. So in yellow here is, in green is the planned impact that they said they would have, and then we went back at the end of the research and we looked at the actual impact that they've had. Same thing down here. We looked at how they've planned to do it in blue, but then what they've actually do it in green, or they actually did it in green, okay? And a couple of things that I want you to pay attention there is, I think we had 25 projects that we looked at. The biggest number of people said that their main impact was to change a policy or program or decision. But then, if you look down here, how have they planned to do it? How are you going to change a policy? It's going to be hard if you don't actually design research with the people that are going to use it. Just 3 people planned to do that, but no one did it, actually. They didn't talk to a policymaker or interact with them at all. So if you want to change something related to a policymaker, how are you going to do that without their help, right? And the other thing is, they said as well, is they wanted to change a practice guideline or a process or whatever. But look how many people said they were going to create teaching, training, seminars, and webinars. How do you expect to change a program if you don't teach people how to do it? Right? Are you just going to write a paper and expect, oh, cool, I'm going to change the way I do stuff because of that paper? Of course not. And then even more alarming was half the people did actually say how they were going to do it. They just said, we're going to change it. How? I don't know. We're just going to change it. And then obviously you need to evaluate your impact to make sure that you've achieved what you wanted to achieve. And those are the questions you can ask. Very simple questions, you know. Who or what changed? How does these changes occur? And that's important as well. What lessons I've learned from doing that. All right? And the resources, obviously, that you need to do it. You need to consider, is it feasible or not? And do you have the people and the money to do it? Okay? All right. I'm just going to skip this, but I want you to think about this for your next session is, now that you've heard about a bit of knowledge users and interaction and things like that, I want you to consider, has it changed the audience you want to reach or not? Or have you now decided who you want to achieve? If you have different groups that you want to achieve, I want you again to separate them by their group. And which strategies are you going to use to achieve those people, to reach those people with your evidence, and who will help you do that, okay? That's what I want you to think about it. You don't need to do it now, but just do it in your spare time before you start your planning. And these are the REF, so the lessons we've learned from REF. So Greenhalgh Maishley looked at this panel here, the submissions for the health and life sciences and medicine, and they've learned those things, okay? So the successful they had 4 stars for the good studies. The impact case studies were studies that articulated how specific groups would benefit and provided evidence of actually reaching them. They established links between their research and the impact, and they wrote things that were easy to understand by other people. And those are the things they propose you to do, okay? This is very important. People get this confused. You're talking about impact. If you're talking about impact, talk about impact, not how you got there. If you're talking about how you got there, then you're talking about the pathway to impact, okay? And that's the question we had for you to do your funtivity. What was the benefit and why was this important? You need to keep thinking about that. Again, dissemination, it's a pathway to impact, not impact. Developing KT resources is also a pathway to impact, it's not impact. And make sure that you follow up, so you know your things have actually had an impact. And one more time, you see how they keep repeating this? Because a lot of people, when they describe impact, they actually describe the pathway to impact. They don't say, I've changed this. They say how they try to change this. And this is a good example of researchers that use 45 and up. So they've submitted the end of the final report for the study. We asked them to provide reports. And on the reports, we asked them, has your research produced any impact? More specifically, have you had a policy impact? So if you look at those examples there, let's get an easy one. This person said they had a policy impact, and they said the policy impact that they had is that they will share their results widely with policymakers and the general public. Does that sound like an impact or a pathway to impact? Pathway, right? They haven't changed, they didn't say they change anything, okay? Same thing here. Have you had an impact? Yes. What was your impact? I've wrote 2 manuscripts that may facilitate programs and it may raise awareness. Impact or pathway to impact? Straightforward, right? Don't make that mistake. And those are good examples of actually impact that 45 and up has achieved, that researchers have achieved and have actually said and proved that they've done, okay? So look how different that is. So my research developed a new model of a program. I developed a whole new clinic was done because of my research. My research was used by the Office for Aging to change something, okay? So those are things that have changed. And those are all the lessons that we learned from Canada, also looking at plans that have a really good, strong knowledge translation plan on them, funding applications, and then ones that are not that good, okay? And again, it's the same thing over and over again. Demonstrate you know what impact is. What were the specific activities that you're going to use? Did you actually engage with people? How are you going to do that? Output is different from impact, okay? You can see it's the same story over and over again, right? And that's the NHMRC stuff as well. Again, Same thing. How did you get to impact? Okay? How did your project contribute to reaching people and impact? So make sure you have that connection, all right? So in summary, think of KT when you're writing your plan as a pathway to your impact, right? KT, a KT framework, whatever, a logic model will help everyone that's involved in the program think about it, how they're going to do it, who are they going to involve it, so who undertakes the how to create what impacts and for whom. There's not one person responsible for impact. It's a whole group of people. It's not a linear activity. It cannot be achieved by one side only, so researchers by themselves will never do impact. They might provide information, but who actually interacts with that, those are the people that will make the impact. We just provide them with the usable information and maybe the way to do it. It's not a one-size-fits-all, KT. So when we talked about the ref, there were over 6,000 impact cases submitted. Within those, there were over 3,700 different strategies and impacts and pathways to impact, okay? So there's no, like I said, it's very contextual, it's very locally based, and you should be, it's very goal-oriented, depends on the goal that you're trying to achieve. That's another, I don't know why I wrote this word, but again, it's another one I cannot say. Impact does not occur serendipitously. Make it happen. Be active. It's a two-way, it's an interactive process, okay? And those are some of the tips that you have that on your notes. And you can use that if you want. It summarizes what we've talked about and hopefully give you some help for things when you're writing your grants, okay? Any questions? I will also be around for the next couple of hours as well while you guys are doing your stuff. So if you don't have any questions now, break. If you do, let me know and we'll help out. Thanks, guys.